Okay. Hey guys, today I'm going to be giving some information about the COVID-19 vaccinations. So vaccines in general have to pass through some phases of testing first to be able to be put out into the public. Some of these testings include animal testing, phase 1, phase 2, phase 3, and then they can be passed into the emergency use authorization, and then further to be approved by the FDA. The 3 phases are basically finding out what dosage of the vaccine works best for the population, as well as increasing the population size of humans in the study every time to gather more information on the efficiency of the vaccine. So what is the mechanism of action of the vaccines, or how do they work, and how do they produce an immune response in our bodies? So I'm going to talk about the vaccine that has shown the most promise percentage-wise on the efficacy of preventing the virus. Moderna and Pfizer/Biotech use mRNA technology that's enclosed in a lipid nanoparticle or a phospholipid bilayer that's sent into the body through the shot. That bilayer drives the mRNA through the body to find a host cell. This is where the immunity kicks in. So the mRNA that is used for the vaccine is from the S protein of the virus itself, which is what causes the terrible side effects. And after the mRNA invades a host cell, it is then replicated inside to where it is reproduced. Now remember, this mRNA is code for the S protein for the virus, so after it is replicated over and over in the body, it can spread and then therefore react with other cells in the body to create antibodies. So if you are ever infected with COVID-19, you already have antibodies to the S protein, which is the virulent factor of the virus. This does mean that you can still be infected, but the antibodies will already be in your body and you can fight better, and you won't even know you have COVID, which is one step closer to eliminating the virus altogether. Also, people die from the side effects and not necessarily the virus itself. Okay, another note I want to add is that the CDC recommends still wearing your masks and staying 6 feet apart while social distancing, but I disagree. This virus has a less than 2% death rate, and so therefore a greater than 98% survival rate. That is amazing for any virus. That's better than the flu in some cases. Scientifically, it is not a deadly virus, and especially with the vaccines out and showing good numbers, washing your hands and taking other common sense precautions like you would during your normal day are all that should be needed. If you have pre-existing conditions or are elderly, this is an at-risk population, and so these people should take further precautions. And again, just like anything else, we should stick with the science and leave politics in their own playground.